Hello, everyone. I am Jane Skiff, a psychiatric mental health nurse practitioner, student at UMass Global University. Today, I have a patient named JT, a 54-year-old black male who recently went through a divorce. He has a past psychiatric history of generalized anxiety disorder and depression. JT also has some medical conditions, including hypertension and gastroesophageal reflux disease, for which he takes medications. He regularly follows up with his primary care physician for his medical concerns. So, we'll be talking about psychotherapy today for JT. Psychotherapy is a collaborative process between a trained therapist and individuals seeking psychological support. It uses various techniques to address emotional, behavioral, and mental health concerns to promote personal growth and well being. Through open discussions in a safe environment, individuals gain insight into their thoughts, feelings, and behaviors. Psychotherapy helps overcome difficulties, alleviate symptoms, and improve mental health. It is used for depression, anxiety, trauma, and substance abuse. Different approaches such as cognitive behavioral therapy, psychodynamic therapy, and family therapy are tailored to individual needs. Psychotherapy fosters personal growth, coping strategies, self awareness, and healthier relationships. JT has come in today seeking psychotherapy to manage his symptoms better. His primary concern concerns sharing custody of his 14-year-old son with his ex wife. His ex wife has been pressuring him to take on more responsibilities in caring for their son, and he feels that he is doing the best he can despite work sometimes getting in his way. He wants to improve his ability to balance his work and parenting responsibilities. Regarding social history, JT is employed as an electrical engineer and is financially stable. He lives alone in a two-bedroom apartment. He occasionally consumes alcohol but does not smoke or use illicit drugs. His parents have recently been placed in a retirement facility and he visits them twice a month. He has a brother who is married and lives an hour away. JT used to enjoy jogging and playing soccer, but has yet to feel motivated to engage in these activities lately. JT has a college education with a degree in engineering. His past surgical history includes cholecystectomy. His family history: his mother, who is 78 years old, has hypertension and congestive heart failure. His father, who is 77 years old, has hypertension and dementia. His brother, who is 51 years old, also has hypertension. Given JT's background and concerns, it is essential to approach his treatment with a holistic perspective, considering both his mental health and medical conditions. Collaboration with his PCP and addressing his work-life balance will be crucial to his care. Now, identification of three psychotherapy modalities that we'll be using in this therapy is cognitive behavioral therapy, psychodynamic therapy, solution-focused therapy. Keywords in this therapy: brief definition of psychotherapy modalities. Now, cognitive behavioral therapy, also known as CBT, focuses on the connection between thoughts, feelings, and behaviors. It is goal oriented and time limited, aiming to help individuals identify and challenge negative or distorted thinking patterns and develop more adaptive behaviors and coping strategies. By examining the interplay between thoughts, emotions, and actions, CBT helps individuals understand how their thoughts contribute to their emotional state and behavior. It provides practical techniques to modify unhelpful thinking patterns and promote healthier ways of thinking and responding to situations. CBT is commonly used to address various mental health issues, including anxiety, depression, phobias, and post-traumatic stress disorder. It often includes homework assignments such as journaling, self-statements, positive reinforcements, meditation, visualization, and breathing exercises. CBT is typically short term, lasting 2 to 3 months, with 8 to 12-week sessions. It commonly used for anxiety disorder, depression, eating disorders and insomnia. Therapists often combine CBT and psychodynamic therapy, initially using CBT for symptom relief and then exploring deeper issues with psychodynamic perspective. The second modality we'll be talking about is psychodynamic therapy. Psychodynamic therapy is a therapeutic approach that emphasizes exploring unconscious processes and early life experiences to gain insight into present day difficulties. Psychodynamic therapy looks to your past to understand your present. It seeks to uncover and understand the underlying causes of emotional and behavioral patterns by examining past relationships, unsolved conflicts, and intrapsych dynamics. Psychodynamic therapy emphasizes therapeutic relationships and encourages clients to explore their emotions, thoughts, and memories in a supportive environment. This can include relationship with your parents, your early attachment style, or how you interacted with your siblings growing up. We'll dive into deep-rooted aspects of yourself, such as ongoing relationship patterns, various interpersonal struggles, different facets of your personality, as well as your stages of emotional development. The goal of psychodynamic therapy is to heighten self-awareness and self-empowerment. In psychodynamic treatment, you're working towards developing a greater understanding of yourself, both now and in your past. The aim is to harness this newfound internal insight to reshape your understanding of yourself, heal emotional wounds, shift unhealthy relationship patterns and behaviors. The third therapy we're going to be talking about is solution focused therapy. Solution focused therapy is a brief and future oriented approach that focuses on identifying and building on an individual's strength and resources. Rather than dwelling on problems and analyzing their origins, this approach emphasizes finding practical solutions and setting achievable goals. Solution focused therapy aims to empower clients by helping them recognize their strengths, generate ideas for change, and implement strategies to overcome obstacles. Now, appropriateness of each identified modality. Using multiple modalities allows for a more comprehensive and tailored approach to therapy, considering the complexity of JT's challenges and cultural background. Each modality brings unique strengths. For instance, CBT, in the context of JT's situation, would be appropriate for addressing his anxiety and depression symptoms related to his divorce, work stress, and parenting responsibilities. By exploring and modifying his unhelpful thought patterns, he can develop more effective coping strategies and improve his overall well being. By using psychodynamic therapy, JT it will help JT understand the root causes of his anxiety and depression. By exploring his past experiences and relationships, he may uncover and resolve issues or patterns contributing to his current challenges. Psychodynamic therapy here will provide a space for processing emotions, understanding his behavior, and potentially changing relationship patterns or behaviors that stem from the past of JT. Now, the other one is the solution focused therapy for JT. This therapy will be appropriate because it will generate solutions to his current challenges. He can develop a roadmap for positive change by identifying his strengths and resources. This therapy can assist him in finding a better work life balance, improving his co-parenting relationships, and rediscovering activities he enjoys like playing soccer. Now, we're also going to discuss expected overall encounter with JT. When approaching JT about participating in psychotherapy, it's important to consider his background, needs, and preferences. Given his history of anxiety and depression, educational background, marital status, parental responsibilities, and full time work, the overall encounter might involve the following considerations. One, psychoeducation. The therapist would provide JT with information about cognitive behavioral therapy, psychodynamic therapy, and solution focused therapy. This would involve explaining each approach and the principles, techniques, and expected outcomes. The therapist would highlight how these therapies can address his specific concerns and assist him in developing coping mechanisms, gaining insight, and achieving positive changes. The other one would be collaborative setting. JT's active involvement in the therapeutic process is crucial. The therapist would engage in a collaborative discussion to identify JT's goals and expectations for therapy. This could include anxiety and depression symptoms, improving his work life balance, enhancing his co parenting relationships, and reconnecting with enjoyable activities. Establishing clear goals makes therapy more focused and tailored to JT's needs. Now, throughout the encounter, the therapist should create a safe and non judgmental space for JT to express himself, ask questions, and raise concerns. Open communication and a therapeutic alliance built on a trust and collaboration are crucial for an effective and beneficial therapy experience for JT. And now we also maybe will anticipate some barriers during this therapy. And one of them is time constraints. JT mentioned being very busy at work, which might impact on his availability for therapy sessions and his ability to engage fully in the therapeutic process. The other one is cultural factors. JT's cultural background as a black male may influence his perceptions, beliefs, and expectations regarding therapy. Establishing a culturally sensitive and inclusive therapeutic environment is crucial to address any potential barriers or biases. Another one is resistance to change. JT might initially resist changes in his thoughts, behaviors, or perspectives, especially if they challenge long-standing patterns or beliefs. Building a rapport and trust with the therapist will be important in navigating potential resistance and fostering motivation for change. Application to cultural diversity. Benefits of using multiple modalities. Now, using multiple modalities allows for a more comprehensive and tailored approach to therapy, considering the complexities of JT's challenges and cultural background. When working with this client, potential barriers or issues might include cultural factors, the stigma around mental health in the client's community, and the challenges of being a single father. The therapist must establish a culturally sensitive therapeutic relationship, respecting the client's unique experiences as a divorced black male. The therapist should also address cultural norms or beliefs affecting the client's helping seeking behavior or treatment engagement. Each modality brings unique strengths. Example of integrative therapy in a different cultural context. Say, suppose the client is from an Asian background where collectivism and filial piety are highly valued. In such a case, integrating CBT can help address the client's symptoms and concerns, while psychodynamic therapy can explore family dynamics, intergenerational conflicts, and cultural influences on their well being. Solution focused therapy can be utilized to identify ways to balance individual needs and cultural expectations, finding practical solutions that respect both personal and cultural values. Now, summary of conclusions. Integrating CBT, cognitive behavioral therapy, psychodynamic therapy, and solution focused therapy in JT's case allows for a comprehensive and individualized approach. CBT addresses immediate symptoms and behavioral changes. Psychodynamic therapy dives into underlying causes and unresolved issues. Solution focused therapy helps set goals and practical solutions. This combination accounts for JT's diverse background, cultural influences, and multifaceted challenges, leading to a more holistic therapeutic experience and promoting sustainable personal growth. Therapists often integrate multiple therapeutic modalities to improve comprehensive and tailored approach to clients' needs. By blending psychodynamic therapy, CBT, and solution-focused therapy, therapists can effectively address underlying issues and immediate concerns, fostering insight, symptom relief, and the development of practical solutions. And so we also want you to know that throughout the sessions, the therapist applies CBT techniques to address negative thinking patterns, psychodynamic therapy to explore past experiences and future influences, and solution focused therapy to identify goals and practical solutions. The modalities are blended and used symbiotically to improve a comprehensive and tailored approach to these challenges. So, welcome, JT. In our first session, we will discuss some cognitive behavioral techniques to help you manage your depression and anxiety. We'll focus on understanding your current challenges and how they affect your thoughts, feelings, and behaviors. We'll work together to identify negative thinking patterns and develop strategies to address them. Now, let's start by discussing your anxiety and depression symptoms. How have you been? How have they been impacting your life?
Well, lately I've been overwhelmed by work and divorce. I've been experiencing constant worry and I have trouble sleeping. I don't have time for myself. I've lost interest in activities I enjoy like
It sounds like your work stress and divorce have been significant resources of distress for you. Let's examine any negative thoughts contributing to your anxiety and depression. For example, what thoughts come to mind when you feel overwhelmed?
I often think I'm not doing enough for my son or I'm failing as a father. I also worry about not being able to balance work and
These thoughts seem to fuel your anxiety and affect your self esteem. Well, while you may not control other people's thoughts or words, you can determine your reactions. In cognitive behavioral therapy, we talk about the ABCs. A being the antecedent event that triggers your thinking. B, the beliefs or thoughts about the event or situation. C, the consequences of your beliefs or thinking. For example, how you feel and how you behave. In other words, how you think affects how you feel and how you behave. This program will help you stop these automatic negative thoughts and turn them around so your emotions are more positive. One way to do this is to practice positive self talk. Now, positive self talk helps you focus on words of encouragement, praise, and support. For example, I am not going to give up. That's one of positive self talk. So, your homework this week, JT, is to practice self talk every day. Another positive way to deal with stress is relaxation techniques such as abdominal breathing. And this I'll show you how to do. In the meantime, let's explore some self-care strategies to help you find moments of relaxation and rejuvenation amidst your busy schedules.
that sounds great. I look forward.
Thank you for coming today. Hey, welcome back, JT. In our last session, we discussed some cognitive behavioral techniques to help you manage your depression and anxiety. and also address some of your immediate challenges. How have you been since our last session?
Well, overall, I've been doing better. The techniques we discussed have helped me challenge some negative thoughts and manage my anxiety.
That's great to hear. Let's continue building on that progress. Today, we will discuss psychodynamic therapy, which focuses on understanding how past experiences shape our present emotions and behaviors. Let's dive deeper into the underlying causes and explore how past experiences may influence your present difficulties. Are there any significant events or relationships from your past that come to mind?
Yes, I can think of a couple. My parents divorced when I was a child, and it was tough on me. I always felt like I had to prove myself to be a good provider and avoid ending up like my father.
I think I've been Sounds like your parents' divorce had a lasting impact on you and created a sense of pressure to succeed. How do you think this has affected your relationship with your ex wife and your perception of your role as a father?
Well, I've been trying to avoid making the same mistakes my parents did, but it's been challenging. I often feel judged by my ex-wife for not doing enough.
Understanding these connections between your past and present experiences is essential to gaining insight and making positive changes. So, in psychodynamic therapy, we aim to bring these unconscious patterns to light and work through them. You can break free from these repetitive patterns by gaining insight into your experiences and emotions. In our next session, we'll continue exploring your relationships, including your co parenting dynamics and any unresolved conflicts affecting your well being. Welcome back. Let's shift our focus to finding practical solutions to your challenges. We'll work together to identify your strengths, set achievable goals, and develop strategies to improve your co parenting relationships and overall well being. What would you like to accomplish in our sessions moving forward?
I want to balance work and personal life better, improve communication with my ex-wife, and reconnect with activities I enjoy.
Great goals. Let's start by brainstorming small steps you can take to achieve these goals. For example, how can you create dedicated time for yourself amidst your busy work schedules? Or how can you improve your communication with your ex wife?
I can set boundaries at work and schedule regular breaks for self-care, and I can initiate open and respectful conversations with my ex-wife, focusing on finding common ground and shared responsibilities.
Excellent ideas, JT. In our future sessions, we'll continue building on these strategies and monitor your progress. Remember, even small changes can lead to significant improvements over time. So, if all obstacles were removed and you had the freedom to create the life you desire, what would you be doing differently?
If all obstacles were removed, I would prioritize strengthening my bond and repairing my relationship with my ex-wife. I would devote more quality time to activities we both enjoy, have an open and honest conversation, and create cherished memories together. I would actively work on co-parenting, fostering understanding, and creating a supportive environment for our son's well-being. Ultimately, I envision a future where our family can rebuild trust, natural love, and provide a positive upbringing for us.
That sounds great. Thank you for coming today. See you next time.
Thank you.